Everyone, thank you for joining us for your weekly medical update. And so we'll get started. Next slide. So again, this is what we consider like the weather report. We have in our state, over 8,000 cases with over 100 deaths. And within our immediate vicinity, we have 57 cases in Antelope Valley with 2 deaths. What I want to share with you, even though if you look at the lower left, that our numbers do continue to increase, California is making a difference with the safer at home. So please continue to do that. If you're sick, stay home. Do that social distancing so we can continue to flatten that curve. Next slide. So this is something you will always continue to see, and we are at HPCon Charlie, and you can see all the things that we're doing to safeguard you and safeguard the community. This is a whole of government, whole of nation effort. So we are working with our local community partners. We are working with all our teams across the base to make sure we're doing everything to keep you safe. Next slide. Again, these are our services that are available. Even though they're degraded, there is nothing that is not open, whether it is virtually or face-to-face. What you may be seeing is more virtual appointments, and as well as our acute services we are actually doing outside our facility, because again, we want to protect you and our community, so we are doing everything to be able to do that, as well as we are getting further guidance as far as when we're doing those virtual appointments to be able to use things such as Adobe Connect, Skype, Google Docs, so all those things to be able to provide that care that you need at the right time anywhere. Next slide. And so this is really, again, you continue to see it. We need your help to flatten that curve. So continue to do what you're doing. Cover your cough. Stay at home when you're sick, do those social distancing, and whatever care that you need, please call ahead so that way we can make sure you get that appointment, whether it is a virtual or face-to-face. Next slide. And another way that you can continue to do that is using the CDC Self-Checker. That's where you just go to that website and you put in that self-checker, and then it will ask you specific health questions, and that will allow you to be able to see, one, what type of care that you may need. Call in your provider, or is it something that you could actually do by staying at home? Next slide. So I know that was really quick because we know that we really want to get after your questions. So these are some of the questions that we had already received. So the first one is, as far as more confirmed cases. That is something that we addressed at the last town hall. We are unable to share that information as far as the exact number of cases. We do have confirmed cases on base that's for Edwards personnel, but as far as what that number is per SAF-PA guidance, we cannot share that. And with Colonel Heyer on Monday, I believe he said it best, because he asked the question, if we had a case or didn't have a case, would that change what you would do? And if it would, that is something that we really need to have you reflect on, because we are doing all the proper procedures and protocols with a confirmed case. And then the next question was, will we get more time and appointments when we are back to normal? When we are back to that normal, we will ensure that you have the time with your PCM to get the care that you need, regardless of what your issues or concerns may be. When it comes to the Genesis rollout, as far as canceled or postponed, Genesis has been postponed, so it is not canceled. Right now, there is discussion as far as it being pushed to the right by 90 days, but we will still receive that new electronic health record. As far as addressing concerns for retirees about access and service availability, yesterday was our first retiree pharmacy day on Wednesday, and it was very successful, and that's from the patients as well as the staff. We saw over 170 retirees. All of it was appointment-based. It was a drive-through service where they would come in and pick up their
prepare food before You touch your face, all that good stuff. So you don't necessarily need gloves, because to wear gloves properly, just like in food service establishments, you do one activity with them, you take them off, wash your hands before donning a new pair of gloves.
Thank you.
Yes, ma'am.
Has there been any extra feedback or awareness on people wearing their own personal masks or face coverings?
So right now, the CDC is reviewing whether or not to recommend if face masks and face coverings are actually beneficial in this situation. But right now, the WHO and the CDC both state that it is not necessary for the general public to wear these out in public. It won't necessarily help you. If you're sick, what that does is it captures all the droplets. You may or may not be coughing out there, and it keeps them inside. But if you're just a normal person that's trying not to get the virus, right now the recommendations from the WHO and from the CDC state that it's not necessary unless you're actively caring for somebody that has coronavirus. So if you're in a healthcare setting, if you're a practitioner, a nurse, doctor, whatever, or if you're in like a nursing home caring for patients that have COVID symptoms, or if you're at home caring for a family member that has COVID, that would be the place where we'd say, really, yeah, you need to be using the normal healthcare PPE. But as far as normal people going out and about, that guidance has not changed, at least from the CDC and the World Health Organization, where it's unnecessary if you're just trying to prevent yourself from being infected to wear it when you go to the grocery store or wherever else.
Thank you. All right, we still have no questions texted in. So I'm coming up with a few that I know we have had some changes recently in our med group. How are we taking care of acute patients right now? Does anything look different for that process?
So for acute care, what we're doing now is everyone is being screened over the telephone. So that's going to be the initial thing. Even if you're going to come in and get a face-to-face appointment, we're going to go through and triage you over the phone. You will probably, by a nurse, and you'll probably be triaged again by a physician. And if they determine that you need to come in, then we will set you up with a time, bring you in, and once again, we will do most of this. If there's any suspicion of respiratory illness, we'll do this curbside. If we need to bring you into the MTF, like I say, that's the screening process, and then we will bring those patients into the MTF to be seen face-to-face by a provider. But we are trying to do most of the care, almost all the care we are doing now, virtually.
So what should a patient do if they have to schedule an appointment?
So they would follow the same process as we've always followed. Call the appointment line. They will generate a TCON to one of the nurses, and they will triage you or look it over and then pass that on to a physician, and then they will reach out to you as far as an appointment goes to assess you.
Is there anything that can be done if a patient does not want to be seen virtually, like they are requesting a face-to-face appointment for a non-urgent need?
At this point, we're not doing future appointments, so we're doing acute care. Anything future we are trying to push out to after this to minimize your risk of coming into the MTF and to minimize our risk of bringing extra people into the MTF. So right now, things that are chronic that you may have been ongoing for 1 to 2 months, those will be things that we will probably not address while we're in Charlie or Delta.
Okay, currently that is all of our questions.
Okay.
Actually, I just got one in. Here we go. Are Edwards numbers reported as Kern County, or are they reported under the unincorporated area of Edwards itself?
So our numbers, I believe, are reported through Kern County. That's who we go to whenever if we have a positive in this case.
And right now, that is our only question. I know personally I've also gotten questions about physical therapy, and right now they're really only seeing patients on a case-by-case basis for post-operative needs if they are living here on base. But with every case, they do need to contact their provider and make sure they have an appointment. For any appointments that somebody may have previously had scheduled in any clinic, it is always a good idea to call ahead and make sure that that is still happening as it was originally scheduled.
Yeah, and I would say to do that with your appointments if you have any schedule in town as well. So to make sure that that appointment still exists for you to be able to be seen.
Okay, Team Edwards, we're not getting any more questions in right now. I'll give you a few minutes just to text those in. Here we've got one more. With the continued increase in cases, do we have a solid plan of moving into Delta? Is there a golden rule to say once we reach a certain number of positive cases or deaths, we will move into Delta or declare a public health emergency?
So I'll start with the public health emergency. So Colonel Heiger, our installation commander, has already declared a public health emergency, and a public health, with his declaration, that allows us to him more authorities as far as what we can do to make sure we're safeguarding you as well as the community. One example with him declaring a public health emergency, that allows us, if we were to start having a reduction in our PPE for our healthcare workers, we would actually be able to go into our assemblages that we would normally use in a disaster. So we are, like I said, already he's declared that public health emergency. And that's part of the Charlie measures when you would consider that. When it comes to as far as Delta, it really depends on, one, what is going on our base, or what is going on right outside our gate. And so that would determine, it's not a magic number where that would be where we would go into Delta or not. It really is going to depend on what that situation is, because Delta means there is sustained transmission. And so that's what we would be looking for, and that's how we would be advising Colonel Heiger when to go to Delta.
Okay, those questions are rolling in now. And I had a request to kind of go back to the question about gloves because our live feed cut out.
Okay.
So if we can go back to gloves and the use of face masks.
Yeah, so for gloves, I guess the best place to start was where I kind of finished. So gloves in any other setting really to prevent contamination. So you wash your hands, you put the gloves on, you do whatever task it is, and then remembering that now those gloves are essentially dirty. So if I went over here and did something else, it'd be passing it just like how you would with your normal skin. It basically makes them just normal. But if you see people out and about, the reason why it's not recommended to just wear gloves when you're like going to the grocery store is because you have to, for gloves to be effective, you have to practice good glove etiquette, so to speak. So if I go out to a grocery store, I'm wearing gloves and I just wear them out through the entire grocery store, I'm touching everything, whatever. I touch my food and I go home and I still have the gloves on, it doesn't really do anything. So what you're supposed to do when you wear gloves is you're supposed to do whatever the task that is that requires gloves, take them off, wash your hands, go about whatever else you're going to do, and then if you're going to don the gloves once more, you wash your hands, you put them on, do that specific task. They're not really, it's not necessarily effective at all if you keep just wearing them throughout the day or throughout like a long shopping trip or whatever else you're doing, because then it basically is your human skin at that point. It's an extra layer. And then in regards to masks, the CDC and the World Health Organization currently have not changed their guidance, saying that masks themselves have not been proven to prevent someone from contracting coronavirus. They are useful if you're sick, and it captures all those basically gross particles that you're going to either be coughing out, sneezing out. It prevents somebody that's sick from spreading their stuff out. It doesn't necessarily prevent you from getting ill from coronavirus. It's already necessarily around you. So right now they have not changed their guidance. The WHO and the CDC have not changed their guidance as far as normal people just wearing masks out, trying not to get coronavirus. It hasn't really been shown to yet, at least. And I know they're reevaluating their stance currently, but so far it has not been shown to prevent disease. It is good, though, as I mentioned before, if you're taking care of someone that has coronavirus, if you're a healthcare worker in those types of very intimate settings, that's when PPE actually helps, because you're right there, you're with somebody, you're doing a bunch of other stuff as well to prevent infection control. But for the layman that's just basically walking around doing their normal life, practicing the normal social distancing, that's absolutely more than sufficient, and a mask will not necessarily add any layer of protection.
Okay. And we have a few more questions about Delta. This one, it says, and again, this is not quite a medical question, but there's questions about once we go into Delta, will retirees still be allowed on Wednesday? And also if there would be a grace period for getting on and off base. And I'll address this one off screen right now, just because I am aware right now the current guidance allowing retirees on base on Wednesday will be suspended should we go into Delta. We can't say if there will be more guidance after that, but the current guidance does clearly state that is only good until we go into Delta or other situations change. And as far as grace period, I do know that units are working right now to get the names of people who would need access So make sure you're talking with your unit or your sponsor's unit right now to ensure it, should you have a need for base access, that is addressed with them. This question may have been asked already, and it was, okay. So we've got a late viewer. Are we able to say how many cases we have that are base related?
And we are not able to say that. That is per SAF PA guidance. And if you are able to catch Colonel Higer's town halls, he actually explained that very well. As this is not our only adversary. COVID-19, we are fighting that, but we still have a mission that we have to keep as the warfighter. And so that information, if we were to share that information, that is something that our adversary, our near peer adversaries, those that would want to harm the United States would be able to use against us. So that is another reason, besides that protected health information, that we are not sharing that information as far as our exact numbers.
Okay, a question about virtual appointments. Are they available for retirees or only for active duty and dependents?
So those right now are available for all beneficiaries. So the only problem we run into with retirees is, once again, if we do need to see you face to face, that may be pushed out until Wednesday. We may not be able to get you in as soon as we normally would. But yes, we are still seeing everyone virtually and doing appointments.
Okay. We've got one more question to readdress the infant immunization options.
Such as the timelines?
Yes. What are we seeing as far as immunizations for infants? What can we see?
So we're immunizing at 2 weeks, 2 months, 4 months, and 12 months right now. And if you are admitted to the CDC as mission essential, we will provide the 6-month vaccinations, 15 months, and those to follow also. But we require a little bit more paperwork for that. But if you call the appointment line, we can let you know what we need to do those other immunizations.
Okay. And what does the long term look like for the health protection conditions at Edwards Air Force Base? Long term, what can we expect?
We are in this together. This is, you've heard me say, this is uncharted territory. So we are in this for the long haul. When you look at the prediction modeling, some say we'll see the peak sometime in April, but we need to be prepared to be able to stay in these conditions all the way into the summer. So we are prepared to be able to provide the services that we are for that duration. And the way that we're taking care of our staff to be able to do that, we are doing the split operations, so that way we have that bench to be able to provide this care as long as it's needed.
Okay, another question about masks. Are medical grade / construction masks being allocated from stores to healthcare and government facilities?
Repeat it again, I'm sorry.
Are medical grade and or construction type masks being allocated from stores to healthcare and government facilities? So are we trying to basically take those out of the local population and direct them to these places that need them?
I know that in our local community, that is discussion that is going on. As far as for our MTF, currently we have adequate PPE supplies, but we work very closely with our MAGCOM. If we were to start seeing a reduction, that they are there to support us during that time. So I know they are looking at that from an enterprise-wide, making sure all our military treatment facilities have what they need during this COVID-19 crisis.
Okay, one more question about about masks, but this person's asking cloth masks. Is it true that cloth masks help people who are well from becoming contaminated while they are out in public when unavoidable?
I'll take it a little bit, because I do know that CDC, they were looking at guidelines, because there is, as Captain Lanker was saying, that they don't know, there's not enough evidence to say, does it help or does it not? But it can't hurt. So they did come out and say, if you're wearing those cloth masks, that it can't hurt you if you're wearing them. Anything to add to that, Captain Lanker?
No, ma'am.
if anything, it is more to help you from getting droplets out of your body into contact with other people.
Right. But there's still not enough evidence out there yet.
Yes.
It would benefit someone more as a carrier than if you are actually trying to prevent yourself from catching COVID-19.
Okay, here's a question that I think we can't really answer right now, but we can absolutely take it to our Facebook page. Is there a simple flow chart anywhere about exact steps to take if you experience symptoms? I know to consult the CDC tracker. Then what next?
All right, so if you're using a CDC tracker, that it will actually tell you if you need to call your health provider. So if you are having symptoms, call your provider, call the medical group, and depending on what symptoms you are having, that will determine what are the next steps. So just say you are having the shortness of breath, you are running a fever. Depending on that, you actually may be told that you do need to be seen and that you need to go to the ER. Or if it's mild symptoms, they will say that you need to stay home and monitor, and if they are worsening, to give us a call back.
All right, and it looks like on that note, that may be our last question.
And then I will just pile on a little bit more with that last question. So if that question was trying to get after testing, with our local community, the guidelines haven't changed as far as they will only test if you're being hospitalized. And although here on base we are working to increase our testing capability and have more test kits, until that time arises, we are using that risk-based assessment as far as to test. So those individuals that are considered high consequence, so in high traffic areas, healthcare workers, those that are at-risk populations, and so those are the ones that we would currently test at this time.
Through at this time.
All right. Well, thank you again for tuning in. Please keep your questions coming. So even if we're not on, we are using our Facebook page to be able to answer your questions. Again, this is a team effort, a whole nation effort. We are here to support you. The Secretary of Defense had basically his own town hall, and his number one priority is taking care of you and protecting us, as well as then we still have to be able to perform our mission capabilities, and that's where we're finding that balance to be able